ultra runner. I've run my entire life, and so there came a point where when I started to run, my left Achilles was hurting. I needed to find a doctor that would allow me to run without pain.
We had tried so many different treatments. I wanted to get in good shape. I wanted to work out, and I couldn't. And it was very frustrating.
I had a recommendation for Dr. Poland, and Dr. Poland's like, oh, I know what it is, and pulls out some literature, and it's like, oh, you have a neuroma, and then we ended up with surgery. Unfortunately, I still had this sensation, some discomfort in there. So he's like, well, let's try the laser. And I actually teach science, and I was like, wait a second, how's a laser gonna help my foot feel better? And then the next day, and I was like, wow, my foot felt so much better. I was pleasantly surprised.
I provide education to the patient on the laser therapy, explaining what the laser is, how it works. I have educational material on it. So by the time we counsel them and talk to them and we actually execute on providing the laser therapy, they're confident that it's not going to be a painful experience for them.
After I had a few treatments with the new laser, I started to feel more comfortable, and my feet actually started to feel like normal feet. I mean, it was unbelievable.
When the laser was introduced to me for treatment, I was over the moon because I was looking for something that was non-invasive, if you will. I didn't want surgery. I didn't want something that was going to potentially even hurt me in the long term.
Patients that are ideal candidates to get this treatment are any patients with acute pain, chronic pain, post-surgical treatment, peripheral neuropathy, plantar fasciitis, achilles tendinitis, things of that nature.
It's non-invasive, it's non-drug, it's just something external to you. I'm so happy when I get off that table because I can move my ankles and they feel good, they're limber. For me, it's really been indispensable.
If I were talking to someone else about, like if they were on the fence about doing this, I would really say it's not invasive, it doesn't hurt, and what do you have to lose if your feet have been really bothering you? Give it that chance.
I would highly recommend it to anybody that wants to be active, where I'm a 50-year-old male that wants to continue to run for the next 25 years.